I am Dr. Dilusha Lamabadusuriya and I am a consultant physician, and today I would like to talk to you about obesity because this is an important and common health problem that is happening in Sri Lanka. So what is obesity? Obesity is the accumulation of excess body fat or abnormal body fat in your body. So this is not just your physical appearance because it has a lot of adverse health outcomes. So how do we diagnose obesity? We do this through calculating something called the body mass index or BMI. So we measure somebody's height and their weight and we do a calculation, and if your BMI is about 23, in this part of the world you can be considered as overweight, and if it is more than 25, you are considered as obese. But remember, having a normal BMI does not exclude obesity, because sometimes we have excess fat depositing around our waist, and actually that is the worst kind of fat which causes a lot of problems, and that is known as the visceral fat. So it is also important not only to measure BMI but to keep an eye on your waist circumference. So a waist circumference of more than 90 centimeters in a male and more than 80 centimeters in a female is considered abnormal. So what happens when there is obesity? Not only does it cause a lot of mechanical problems like strain on your spine or your weight bearing joints like your hips and your knees, it causes an increased risk of lot of the diseases such as hypertension, diabetes, liver disease, heart disease, stroke, and even it increases your risk of cancer. So how does one become obese? In a minority of people, it is due to a hormonal imbalance or due to a genetic factor, or it could be even a side effect of a medication that you are taking. But in a majority of people, it is due to the fact that they are taking too much of caloric intake and not spending enough calories. So it is an imbalance between your energy intake and energy expenditure. So therefore, diet plays a key role in development of obesity. Diets rich in refined carbohydrates, saturated fats, high intake of refined sugars in form of food or in drinks can lead to you gaining excess weight. And nowadays we lead busy lives, but the lives are sedentary. We are not moving or we are not physically active as before. So both these components contribute greatly to the rising trend of overweight and obesity in our country. So in summary, obesity is a serious medical condition, and remember to keep an eye on your weight as well as your waist.